Yeah. Oh, let's don't even think about it. Yeah. Everybody ready? Good morning. Senate Bill 192 sends a very strong and clear message to two different groups of people. One message goes out to the heroin traffickers in Kentucky. We're coming after you, we're going to put you out of business, and we're going to put you in jail. The next message goes to the thousands of Kentuckians who are addicted to this terrible drug. We're coming to help you. Work with us and help us to help you get on the road to recovery and to becoming a productive member of society. We all know that there is no silver bullet in this battle against heroin abuse. There is no ultimate answer. It's always going to be an issue that we're going to have to battle. But Senate Bill 192 has given us a group of very effective tools to use in that battle. And we can make progress in that battle because of the comprehensive legislation that was passed last night. There are a world of partners that need thanking for the passage of Senate Bill 192. Everybody up here would agree with me that the most important partner in this were the people of Kentucky, because they demanded that we create an aggressive set of tools to battle this problem. And to the credit of the folks standing up here and many others who could not be here this morning, we heard. We heard the people of Kentucky and we took action. And the result is before you today as Senate Bill 192. It has an emergency clause on it, so I wanted to sign it as quickly as we could so that we can put those tools into operation. Several of those partners that have helped in this battle are here today, and I want them all to step up and say a few words before we sign this bill. One of those partners is Attorney General Jack Conway, who for the last 8 years has joined with the legislature and with me in battling drug abuse in this state, both prescription drug abuse as well as illegal drug use. And so, Attorney General Conway, please come up and say a few words.
Well, thank you, Governor. I appreciate that. I want to thank you for making certain that this bill got passed. I want to thank the First Lady. You have been a remarkable partner in our efforts to expand treatment and to educate the people of Kentucky about the dangers of prescription pills and heroin. I want to thank courageous people like Representative Joni Jenkins and Jefferson County Attorney Mike O'Connell, who have come forward in the last year or so to share their personal stories about how heroin addiction has affected them and their families. And I want to thank all the families of Kentucky who helped push for this legislation. I want them to know that their voices matter and that their voices were heard, and that ultimately led to the passage of this legislation. With the quick stroke of Governor Beshear's pen, this bill is going to help those of us in law enforcement to save lives and to beat back the scourge of heroin in the Commonwealth. I want to thank the members of the General Assembly for doing their job, for stepping up to the plate and making certain in the final hours of the session that this bill did indeed pass. In December, I stood up with members of law enforcement and with prosecutors to outline our priorities and to state what we thought should be in any final bill. And I said at that time, and I said it yesterday, I didn't care if the bill was a House bill, I didn't care if it was a Senate bill, I didn't care if it was a Republican bill, I didn't care if it was a Democratic bill. But we needed tools to deal with this epidemic. I appreciate the work of Senators Westerfield and Senators McDaniel to help shepherd this measure through the Senate. I appreciate the effort of Representative Overly and other members of the leadership team to find additional money to be included for treatment on the House side. When we said we needed increased penalties for large-scale traffickers, that's in the bill. When we said we needed increased access to Narcan for first responders, that's in the bill. We said we needed additional investment for treatment. That's in the bill. And we also said we needed a Good Samaritan defense. That's in the bill. Those priorities are there, and there's much more. And we in law enforcement, and on behalf of the community of prosecutors throughout the state, we thank the General Assembly for their work on this issue. People who traffic heroin need to go to jail. People who are addicts need treatment. Heroin addicts are filling our jail cells, our courts, and our treatment centers. In fact, in 2013, the most recent year for which we have data, there were more than 1,500 heroin trafficking charges in the Commonwealth of Kentucky. According to the state police, people testing positive for heroin in the state crime lab has gone from just over 400 in 2010 to nearly 1,500 in 2012. Indeed, heroin has been killing Kentuckians and tearing apart our families. Over 200 people died from heroin overdoses in 2013, and that's a 200% increase from the year before. And unfortunately, we think those numbers will go up for 2014. We're seeing overdoses up in every corner of the Commonwealth, in every demographic group, and in every corner of our Commonwealth. But make no mistake, the treatment provisions in this bill and the additional tools are going to give people second chances, are going to improve lives, and give many people a chance to stay clean. And I appreciate the emergency provision in this bill to give us those tools immediately. I feel like we have some momentum going on this issue. It was just yesterday morning, about 23 hours ago, I was with the First Lady in Louisville to announce that we were giving hundreds of Narcan kits to the emergency room there at the University of Louisville Hospital to deal with the increase in overdoses that they've seen. We're doing the same for 2 other major hospitals. We have the people of the Commonwealth of Kentucky focused on this issue, and I can assure you that the Office of the Attorney General is focused on doing our part to make a difference in this epidemic. I'm proud we've come together to tackle this issue head on, and again, we will be about our work. This is a great day in Frankfort. I appreciate the members of the General Assembly putting people over politics, and Governor, thank you for the opportunity to speak.
I have said many times over the last 2 to 3 years that Kentucky is still one of the places in the United States where democracy still works, and it works here. As you all know, we have a divided government in terms of partisan politics, but that government comes together and puts the people first and politics second on most issues. I'm very proud of that, and I'm proud of the leadership in both the House and the Senate for bringing us together on this issue. I'd like to call upon President Stivers to say a few words. Mr. President.
Governor Beshear and my colleagues, General Conway, I really wasn't expecting to say anything, but as I've said, being a part-time lawyer and part-time politician, I won't be at a loss for words. But no, I do want to say this. We came into this session knowing that for the past several years we've been attempting to deal with the problem related to heroin. And as it grew from the northern Kentucky region, it spread into other parts of the state, not quite into my area as prevalent as it is in Louisville, Lexington, and northern Kentucky. We knew we had to take action. There were several things that we kept seeing, the statistics about the increase in both use, need for treatment, and the real tragedy about how many deaths we were seeing on a monthly basis, the equivalent of almost 22 a month. And that's a shocking figure. And so we knew that the state of Kentucky needed some type of change in direction in the policies we had. And a group of people came together on both sides of the aisle, both chambers, and started working on the issue well prior to the session. And with that, we came into the session, and as I said last night to many of the media, I think there was some skeptics about what could be done in the environment we're in. But again, Governor, I think we proved the skeptics wrong. That, as the General said, we can set aside politics to look at the policy. And this is another day, I think, in the last 2.5 years we've been here, we've seen that happen. And when we go forward, can we guarantee success? No, we can't. But we have guaranteed the opportunity for people to do things different, to try to take on the challenge of dealing with a problem that has come to fruition because of other things we've done to make it harder on pain clinics and methamphetamines and things of that nature, an ever-moving target. But it will be continue to address, and I think it is a good combination of both penalties and sanctions along with the recognition for the need for intervention, education, and rehabilitation. So I want to thank all my colleagues, House, Senate, Republicans, and Democrats, and the governor's office for the leadership of putting this together and making this session, I think, a very productive session, especially this being the cornerstone piece of the session. So, Governor, thank you and the First Lady both for your leadership and the ability to be here and for us to accomplish what we have done in the 2015 session.
Representing the House leadership is Majority Leader Rocky Atkins. Rocky.
Well, first of all, it's been a long night and a long day. I'm glad to see everybody here this morning, and I first of all want to compliment members of the House and members of the Senate on a very, very important issue, and I'd first of all like to compliment both the House and the Senate on what I think was an outstanding session. And as Senator Stivers said, I think this is really a defining piece of legislation that really defines what happened throughout this session, working in a very bipartisan way to really come to terms and come to agreement and compromise on an epidemic, an issue that stretches all across this Commonwealth from the corner of the state where I come from Ashland all the way to Paducah, and to be able to come together in so many different parts of this to make it become a reality. I want to thank the members of the House, the chairman of our Judiciary Committee, a person who's put his heart and soul into this issue and other issues, Chairman John Tilley. John and I spent a lot of time together while we're here in Frankfort. Those of you that don't know, we rent a place together, so I get to hear the speeches, and I get to be well educated on issues that John really cares about. And those of you that know John, I think you understand exactly what I'm talking about. The work group who work with John worked so hard to make sure that the pieces and parts of this piece of legislation came together to make sure, as Senator Stivers said, it would work. Senator Westerfield, you don't come to the House to speak, but I also get to hear your speeches as well from time to time, and the work that you and your colleagues done to pull this together. You know, I've been here 27 and a half years, and good pieces of legislation don't come easy. It takes a lot of work, and it takes a lot of people willing to hang in there to the bitter end to make these things become a reality. And if it was easy, everybody'd do it. But when people work together, good things happen. And I think we're here today celebrating that, and I want to congratulate both the House and the Senate, the Democrats and Republicans, who show that working in a very bipartisan way, we can make good things happen for our communities in this great Commonwealth all across the state. So thank you. I'm honored to be here. Thank you, Governor.
As Majority Leader Atkins mentioned, two people are here, one from the House, one from the Senate, who helped lead the charge on this issue, who helped negotiate through all of the difficulties that we had to arrive at this point of having a strong, aggressive, comprehensive bill to attack this heroin issue. And that's Representative John Tilley, Senator Whitney Westerfield. I want to ask each of them to come up and say a few words.
I'll go first. Senior, yeah, that's right. You can tell by the gray he doesn't have any yet. Those of you that know me know I don't often use a script, and that sometimes gets me in trouble. But I don't have a script this morning. I sometimes speak on intuition and gut and feel, and it strikes me today that to my left there's a group of ladies who follow this process that embody the reason we came together. They've lost people in their lives that cannot be replaced. And we've all at times internalized that kind of suffering in ways that we only can without having actually suffered that personal loss, that very personal loss. And those of you that followed the the negotiations yesterday in the House and Senate, know that they were emotional, these negotiations. We didn't always agree, but we always wanted to get to the same place, and that's this place here. And some of us became emotional in that process, and I don't mean just ranting and raving. I mean deeply personal. I read a letter on the House floor yesterday. It was one of 100 I probably received, handwritten letters, not to mention thousands of emails. And I could have read from any one of them, but the one I read from talked about the inherent worth and dignity of people, no matter what their position or status in life. And that's what has overwhelmed me in this process. With every drug crisis we have, it should be about the inherent worth and dignity of people. And this bill does a lot of things. It does a lot of things we couldn't possibly talk about. And I want to share an anecdote, well, just a story from last night. After you all in the front row had grilled me on the provisions of the bill and you all followed it, kudos to what a great media corps that actually paid attention to what's in the bill and asked insightful questions and not just glossed over it with sound bites. But I got a call from a national reporter who'd been following this story. We'd been kind of monitoring. He'd been asking for an interview when it finally passed. And before we started what was a 45-minute series of questions, he said to me, listen, I don't often do this. I've written some very negative pieces about drug policy in other states. And I've looked at some things in your state that I think need work. But he said this piece of legislation, just in my humble opinion, is one of the best I've seen. He said it's comprehensive, and I'm really amazed by the width and breadth of this piece of legislation. And he began to break it down. He didn't stop there. He said, you provided for the care of addicted babies. Senator Westerfield's bill that we've worked on together is included in this piece of legislation. Don't forget that. Mary Michael, we've had a 250% increase in the last couple years, 3 years, babies born addicted to heroin, essentially. NAS babies. After the human suffering is over, we get to look at the tax bill. It's about $250,000. Or we can pay for treatment for these addicted mothers at $25,000 on the front end. It's a pretty good return on investment. And if you've heard the cry of a baby who's addicted to opiates, it doesn't really matter what it costs if you can ease that suffering. So we did that. That doesn't get talked about a lot. The penalties are in the bill, and they get talked about a lot. But let's talk about the addicted babies and those mothers that can go to Senator Stiver's district, President Stiver's district, and there's a waiting line to get into the Independence House. We've been there twice. There's a waiting line there to get into this place. And when they get in, they're treated like people with inherent worth and dignity. And these babies are born not addicted. And the mothers can leave clean and sober at a fraction of the cost it takes us to care for them in your hospital, Mary. We have elimination of treatment barriers in this bill. We have, again, as you heard, the use of naloxone and no-charge Good Samaritan. It's not a defense. It's a no-charge Good Samaritan policy like the other 25 states that have passed it. It will save lives, there's no question. We have so much more in this bill. He began to break it down. Representative Jenkins, during this process, when you come together as stakeholders and you hammer it out and you challenge one another, this is what happens. Representative Jenkins had a great suggestion, and he was overwhelmed by this. He's never seen this in any other state. He said, when you have an overdose victim in an emergency room, how do you get that person into treatment without charging them with a felony? And we don't want to do that because we want to encourage that call to save that life. That's the whole reason for the Good Samaritan provision, that we all support it. But she said, why don't we treat it like a victim service? Why don't we get intervention in at that point? Why don't we allow the hospital to team up with our community mental health centers or other providers and make a call and get somebody in there to talk to that overdose victim? And not only that, but the Senate worked on a provision then to follow up and say, well, what about the caller who's probably involved in, may not be an addict. We hear stories of people who are not addicted, who won't call for help because they're afraid that that victim will get in trouble, much less themselves. And that's why we're losing lives. And so now we have a provision in the bill to hook that caller up with services. He said he'd never seen it. He said he thought it was brilliant. We have study after study after study, and he didn't mock any of them. Sometimes, we're the studiest place around, as one of our new colleagues said. but sometimes they're used for a purpose. And they're used in this case to report back to what I hope will be as effective, President. I was proud to co-chair the Pill Mill Task Force, Implementation Task Force. We have the same thing in this bill. We're not going to sit by and hope that it works. We're going to monitor it with meetings and reports from all stakeholders and from all areas. That's why I'm proud to have come together, because we didn't just ramp up penalties for commercial level traffickers. We didn't just provide money for treatment, desperately needed treatment in this state for so many purposes. We didn't just infuse local systems with the funds they need to deal with this on the ground. We didn't just provide a needle exchange program to stem what I'm telling you is going to be a tidal wave of bloodborne illnesses. It's already hit this state, and it's coming across the river, and you know that. And thank you for your willingness, anyone who had doubts about certain provisions, to put those doubts aside, listen to the research, and open your minds up to every possible idea that can help stem this tide. So forgive me for getting emotional yesterday, today, and any time in the future, but if we're not here to do what we've done today, then we should all just go home. With that, I want to also say my colleague, Senator Westerfield, many of you know sometimes we share rides. We live just half a mile from one another in Hopkinsville, and we don't make any apologies for saving on gas. And it gives us time to talk, and we don't always agree. And we're upfront about the politics that actually sometimes dictate some decisions we have to make. But I can tell you this: there's a friendship and a collegiality that exists amongst a lot of members. But since he's going to speak next, I can't leave this podium without thanking him for that. And I don't think we'd be here today if we weren't able to have some of those long conversations on that 3.5-hour drive.
Up and walk away from the table because we knew what needed to be accomplished. We knew the problem existed, and we knew that our work wasn't done. And the provisions that were the most contentious were the things that were the most important. Penalty enhancements, modest enhancements for the people that are genuinely trafficking and not addicted. We needed that, and we've accomplished it. Good Samaritan provision so that those callers and the people that they're calling for feel safe to call, so that lives are genuinely saved. We needed it, and we fought for it, and there it is. The needle exchange program, perhaps one of the most controversial parts. People, some commented about the informational meetings that we had about both chambers' respective bills and the opposing chambers' Judiciary Committee meetings. But I'll tell you that when the Senate heard House Bill 213, minds were changed that day on needle exchange. And we began to make a case for that and advocate for that, for why, whether or not it's a standalone bill doesn't matter, but as a part of this entire package, as a part of this bill, this effort to attack this problem from not just one face, but from every possible face that we could. I was proud that we were able to advance that cause. And so here we are. And not just these folks. I named the judiciary staff, and last night I failed to mention a handful, Alicia and David. I don't know if they're here. Our interns, Chip and Dale. And Sarah Kidder and Jonathan Scott with Health and Welfare Committee. I didn't thank them last night, but definitely want to. All of those folks made this, not to mention these advocates, many of whom are here. Senator Chris McDaniel, who couldn't be here. Just a slew of people worked very hard to make this happen today. And I'm honored to have just a small part of it. So thank you for that. Thank you all.
Okay, before we sign the bill, why don't we go ahead and have any questions that you all might have on the legislation?
Governor, is there anything in this bill that is unique, like the first in the country, or is this building upon other ideas?
I think the caller identified several things. One in particular is the link to intervention in our emergency rooms, which we're seeing those visits far too often in overdose cases. Thankfully, they don't all result in deaths, and when they don't result in a death and we have somebody, a captive audience, we have the ability to link a mental health professional, a counselor, someone who's an expert in substance abuse with that person. The other end of that spectrum getting information from the caller, not violating any privacy rights, but getting information to be able to find out the identity of the caller, to also try to intervene with the caller. I think importation, Governor, that's a good. The importation, there was a concern from northern Kentucky that the drugs were coming in from Ohio and they were filtering in, and we have an importation. There are just a couple of other states that do that. Ours is a little bit different, but it's certainly, I think, unique, and we're one of the first to get out on an importation charge with a separate charge from trafficking. As we say in the business, it's a stackable offense. It'll make them think twice about importing drugs into our state. There are the elimination of treatment barriers, I think, in our system, which are unique in terms of periods in which we have to provide licensing and credentialing and approve those applications. I think I'd like to say that some of our neonatal care provisions are very unique, and I think our focus on that, because we've been looking at relieving that kind of suffering for some time. To say we're the first in the country on those, I will say this, our staff, we reached out to every drug policy expert, every policy expert in these fields we could find across the country. Multiple teleconferences, multiple meetings, and our staff looked at every state. And there is no magic legislative wand to deal with this problem. If there was, we wouldn't be sitting here talking about the number of overdose deaths that we have. But I will tell you that I was gratified, and I think my feelings were validated on this bill when I talked to that national reporter who looked at all the other states and said, I believe you have one of the best pieces I've seen. And there are other pieces I think that are unique. I could go on about it, but again, I think the focus on Vivitrol is unique. Many of you know it's been called a miracle drug, and those of you who haven't heard me say this, I apologize if you heard me say it. I'm going to stay on message here because I believe it's important. But Judge Tapp over in southeast Kentucky has 16 people on a Vivitrol trial, and they're in their 7th or 8th month. These are heroin addicts, impossibly difficult to break that cycle, as so many know. And after 7 or 8 months in this SMART program, which is from House Bill 463, these folks on Vivitrol are clean, every one of them. Only a couple of failed drug tests for marijuana, not heroin, out of 16 participants. Now, you don't have that rate of success with any other type of substance abuse program. It just doesn't exist. And it is expensive, but a cycle is about the third the cost of a year in prison. I could go on, but those are unique things about our bill, and there are more.
Any other questions?
When will the needle exchange programs be up and running?
It's local option.
They're obviously.
Depends on when the local
Does it
government.
have to be approved first before the health departments?
It does by the local legislative body.
That's
depending on
right.
whether it sits in the city or the county, but they've got to decide, because the bill on that part is very.
I'm sorry.
You're fine. The bill on that part is very limited in detail, because the needs in Christian County are going to be different from the needs in Kenton County, where it's a much bigger problem. So we didn't go into establishing what they should look like. Their counties and localities are able to set it up however they need to.
And medical protocol will control that. That's ultimately there's already medical protocol in place to determine. But we do have the local options set up. It's a very simple process. We are unique in that regard. Most states don't have those barriers, but we thought we needed that to give some members the comfort to vote for it.
So will government, legislature, the governor be encouraging these communities to go ahead with this?
Certainly, I encourage every community to look at the possibility of opening up needle exchanges. I think it's a public health issue. It also allows us to establish contact with a lot of people that are in trouble, and to hopefully bring them into some kind of treatment process in the process of dealing with them on dirty needles.
That's a great point, Governor. As you heard me say, if you enter the program, you're 5 times more likely to get into treatment. That's a validated finding over and over. With over 200 programs that already exist in 34 states and 5 states around us, this doesn't make us an outlier. I think it's the proper public health response to a public health crisis.
Overdose deaths have been increasing a lot as involved. I don't think the numbers are out for last year yet. I expect them probably be high again. Do you expect this bill to have an immediate impact, or will it take a year or two before we see results in trying
I think it depends on how quick we can get the word out. Between the Good Samaritan, the naloxone getting in the hands of first responders, these are the things that can have an immediate impact. I don't know that we need to wait a year for all of that to happen. So as soon as those things start being utilized and the word gets out and publicized that you're safe to call, that you can get the help that you need without fear of criminal prosecution, I think as soon as that word gets out, I think we'll start seeing an impact. It's positive.
I know there was some debate on where the funding is actually going to come from eventually, and it did 10, 11 million immediately, and then 24 million eventually annually. Where is that money going to come from actually, specifically in the budget?
Necessary governmental expense from the Budget Reserve Trust Fund. The governor has it. I appreciate his willingness to now spend it. And I'll turn that over to you, Governor, but that's where it comes from.
We also were able to identify some excess funds in various parts of state government, the biggest amount being excess funds in the, and let me get the phrase right, Mary, the health.
Insurance Trust Fund.
Drawing a blank on the name.
Health Insurance Trust Fund.
The Employee Health Insurance Trust Fund plan. There were some excess funds there, and much of this was addressed in House Bill 510 that passed last night, probably the last bill that passed last night, or one of the last, that transfers funds around to make this amount of money available for treatment.
I also heard that some of it was based on some accounting. You guys thought you could make some savings off of maybe some corrections money. And is that still part of this formula? Did some of the shifting money from the corrections?
That's in the next biennium. The 463 House Bill 463 savings. We've already booked for this biennium, so those are as the out years in the next biennium. 24 million annually.
Okay, so that's what. But
There's
current
more
money-
savings, but that's what we're taking.
The current emergency money comes from
The
those
10 million,
savings,
That's
right.
and the
Two different
24
pots of
million
money.
comes- Okay, gotcha. Thank you.
Right.
We needed infused. We needed money now for a problem that exists now, so we had to find it. That out year money is nice, but it's not going to help now.
Back on the needle exchanges, is there an estimate on how many of these are going to be up and operating? Based on your conversations throughout this process?
Well, I'm going to begin my traveling roadshow of advocacy for them immediately. If anybody wants to join me, I have no idea how they'll be received in these communities. I know that I have heard from. I don't know that I've heard from any public health agency, any professional. Even last year when we began to discuss it, there was a sort of a resounding chorus from, public health professionals and medical professionals. Dr. Alvarado talked about the great work that can be done there last night on the Senate floor. So I think we need advocacy like that to ease that initial feeling that people have about these programs and understand that the research is so sound and really has produced some of the most successful data that we could imagine. And that's why we've been so insistent upon including that in this bill.
Do you have concern that urban areas are more likely to initiate needle exchanges than maybe some rural communities?
Well, I think one would think that would be the case, and I hope it's not. I hope if the problem exists, I think programs can be run anywhere. I mean, the infrastructure is in place to allow that. I think if education begins immediately, I think we can get there. I hope hopefully within a few months. I would hope there would be folks moving on these programs. I think if you look at, I'll say it again. I don't know if anyone in the room's now not heard the line from right across the river that they're approaching levels of HIV related directly to heroin addiction, needle sharing, that have only been seen in sub-Saharan Africa. I don't know how many times we can restate that without understanding how devastating that could be to our state.
Are you talking Indiana or Ohio?
Talking Indiana at this point. The Clark County, the community about 15 miles from Louisville. And understand, too, we had the hepatitis C increase that I had to explain. Many people kept calling me to say, did you actually say that right? And we did. Van Ingram told me this last year. From 2000 to 2012, we've had a nearly 1,600% increase in hepatitis C cases related to opioid dependence, i.e. needle sharing and heroin addiction.
One of the advocates was speaking to us before the press conference started and said that CDC reports actually Kentucky's the highest of Hep C, so in the country.
And I think the Medicaid numbers are off the charts. I want to say $55 million last year to address that problem. And don't quote me on that one, but I think we had slide on that. Dallas Stidley, one of our staffers in judiciary, ferreted that one out.
Anybody else?
This is the real bill today. This isn't ceremonial.
Let the governor check.
That's the real bill.
Yeah.
It's got my name on it.
Yeah.
All right, let's sign this bill. Here we go.
Governor, can you do that one
Can
more
we
time
do the
for
photo
official
again?
had?
Yeah, we can.
We need to keep this clear so we can get everybody.
Okay. All right. Ready?
Look surprised, everybody.
Mike, this is not a resolution.
Everybody got it? Want
One more right here, everybody. Thank you.
We'll go through the signing part again if you want. Look at there, I can sign right over my head.